Okay, guys, I have B for you. We're discussing occupational therapy's role in concussion recovery. That is when somebody has a concussion and they go to occupational therapy to recover. Okay, we're going to discuss that. For B, the text refers to a video segment featuring Melissa Hanson, OT specialist, who discusses the role of occupational therapy in concussion recovery based on the surrounding page content. Hansen likely emphasizes how occupational therapists assist patients post concussion by helping them regain daily function, manage cognitive sensory symptoms, and gradually return to work or school. The focus is on personalized strategies that account for the unique needs of each patient, something occupational therapists are trained to navigate. This aligns with the broader theme of the video page, which highlights health topics such as cognitive function, brain health, and neurological resilience. Also seen in give me 1 second, guys. I'll get the next page. The featured section about foods that may help prevent cognitive decline. If you'd like, I can help unpack specific OT techniques used in post concussion care, or explore how these strategies compare with other neuro rehabilitation approaches. Let me know where you'd like to take this. Occupational therapy, OT for concussion recovery, is all about restoring function, reducing symptoms, and helping individuals return to meaningful daily activities. Here are some of the key techniques used by OTs in this context. Cognitive rehabilitation, task specific training, practicing real life tasks like managing a calendar, cooking, or budgeting to rebuild executive function in the brain, folks. Memory strategies, using virtual aids, checklists, or digital reminders to support short term memory. Attention training, gradual exposure to increasingly complex tasks to rebuild focus and reduce mental fatigue. Virtual and sensory integration, oculomotor exercises, activities to improve eye tracking uh, saccades and smooth pursuits, often impaired post concussion. Light and sound sensitivity management, gradual reintroduction to stimuli, often impaired with environmental modifications, tinted lenses, noise canceling headphones, physical and uh, physical and vestibular supports. Balance and coordination training, especially when dizziness or instability is present, may involve collaboration with physical therapy, energy conservation techniques, teaching uh, pacing, rest breaks, and prioritization to manage fatigue, emotional and behavioral strategies, stress management, mindfulness, breathing techniques, and coping strategies to address anxiety or mood changes. Routine building, structuring daily activities to promote consistency and reduce cognitive load. Gradual reentry programs, coordinating with employers or educators to modify workload schedules or environment. Assistive technologies or assistive technology, recommending tools like screen readers, speech to text, or ergonomic setups. These innovations are highly personalized based on the individual's symptoms, goals, and environment. If you're curious, I can walk you through how these compare with other neuro rehab approaches like speech, language therapy, or cognitive behavioral therapy. Want to delve deeper? Occupational therapy stands out in concussion care because it focuses on restoring uh, participation in meaningful daily activities rather than just symptom. Resolution or physical recovery. Here's how it differs from other common concussion therapies. Occupational therapy goal: help individuals re engage in life roles, work, school, self care, leisure by adapting tasks and environments. Approach: holistic and functional OTs assess how symptoms affect real world performance and tailor strategies accordingly. Techniques: cognitive rehab, sensory integration, energy conservation, return to work planning, and emotional regulation. Strengths: especially effective for persistent symptoms and complex cases. Involving cognitive, emotional, and sensory challenges. Physical therapy. Goal: restore physical function, balance, and vertebral stability. Approach focuses on musculoskeletal and vertebrae systems. Techniques: goal training or gait training, balance exercises, and cervical spine rehab, and graded aerobic activity. Strength: ideal for dizziness, neck pain, and physical decoordinating post concussion. Speech and language pathology or slip. Goal: improve communication, memory, and executive function. Approach targets cognitive communication defects. Techniques: language exercises, memory drills, and compensatory strategies. Strengths: best suited for patients with verbal memory, processing speed, or expressive language issues. Psychology, neuropsychology. Goal: address emotional behavior and cognitive symptoms. Approach: mental health focused, often using talk therapy or cognitive behavioral therapy or CBT. Techniques: CBT, mindfulness, psycho reduction, and coping skills. Strengths: crucial for managing anxiety, depression, or PTSD symptoms that may follow concussion. In short, OT bridges the gap between symptom management and real life function. It's especially valuable when patients are stuck in the "I feel better, but I can't function" phase. If you're interested, I can walk you through how OT integrates with interdisciplinary plenary concussion teams, or how it supports long-term recovery. There is a growing interest in uh, complementary and alternative therapies for concussion recovery, especially when symptoms linger or when individuals seek a more holistic approach. Here are some of the most discussed and reached options. Natural and integrative approaches. Acupuncture may help reduce headaches, dizziness, and anxiety by stimulating neural repair and modulating pain pathways. Essential oils, lavender and peppermint oils are sometimes used for stress relief and headache management through evidence, though evidence is mostly anecdotal. Nutritional support, omega-3 fatty acids, magnesium, and curcumin are being explored for their neuroprotective and anti-inflammatory properties. Mind and body therapies. Mindfulness meditation can improve emotional regulation, reduce stress, and support cognitive clarity. Okay. Yoga and Tai Chi, gentle movement therapies that enhance balance, uh, pro, pro, prior, proprioception and mental focus. Biofeedback and neurofeedback used to retain brainwave patterns and improve autonomic regulation. Manual therapies, cranioskeletal therapy, a gentle hands-on techniques aimed at relieving tension in the central nervous system. Some patients report reduced headaches and improved sleep. Chiropractic care, chiroversal, and concussion management, but some use it for cervical spine alignment and symptom relief. Should be approached cautiously and only with experienced providers. Creative and sensory therapies. Music therapy may support mood and memory and sensory integration. Art therapy helps with emotional expression and cognitive engagement. during recovery, experimental and adjunctive options, hyperbariatric oxygen therapy, or HBOT, being studied for its potential to enhance oxygen delivery and reduce inflammation in the brain. Red light therapy, investigated for its role in reducing neural inflammation and promoting mitochondrial function. Give me 1 second, guys. Something you've been exploring in other contexts too. These therapies are often effective when integrated into multidisciplinary care plans, not used in isolation. If you'd like, I can help you compare evidence-based behind a few of these, or explore how they might complement occupational therapy in a systems-based recovery model. Where would you like to go next? Nutrition plays a powerful role in concussion recovery by supporting brain repair and reducing inflammation and restoring metabolic balance. Here's a breakdown of the most recommended nutritional strategies. Key nutrients for brain healing. Omega-3 fatty acids found in salmon, flax seeds, walnuts, fish oil supplements. These fats help rebuild neural membranes, reduce inflammation, and support neuroplasticity. Magnesium, often depleted after a concussion, it supports neurotransmission and reduces exotoxicity. Sources include leafy greens, pumpkin seeds, and dark chocolate. Zinc, important for neurogenesis and immune function, found in shellfish, legumes, and whole grains. Antioxidants and flavonoids and polyphenols. Okay, hold on. Berries, green tea, and dark chocolate help neutralize free radicals and promote brain-delivered neurotropic factor BDNF, which supports brain cell regeneration. Curcumin from turmeric has anti-inflammatory and neuroprotective properties, best absorbed when paired with black pepper. Vitamin D supports immune regulation and brain health. Sunlight, fortified foods, and supplements are common sources. dietary patterns that support recovery, anti-inflammatory diet, emphasizes whole foods, healthy fats, and minimal processed sugars. Think Mediterranean style. Mediterranean style, olive oil, fish, nuts, and colorful vegetables. Gut brain axis support. Rich fiber rich foods like avocados, berries, and leafy greens nourish the microbiome, which plays a role in neuroinflammation and mood regulation. Hydration. Dehydration can worsen symptoms like headaches and fatigue. Aim for consistent water intake throughout the day. And experimental and adjunctive approaches. Ketogenic and low glycemic diet being explored for their potential stabilize brain energy metabolism and post-injury intermittent fasting. Some anecdotal reports suggest it may enhance cellular repair through though more research is needed. If you'd like, I can help design a simple meal plan to compare how these strategies align with other neural rehabilitation protocols. Would you like to explore that next? Okay, guys, so that is B for you tonight. I will be back on with C in a bit. Okay, for now, Gator Wellness, take care, folks.